So that is what surgery looks like. Again, I'm pretty bad on it, or pretty negative about it, but do want to point out that it is an excellent, excellent tool that we have available to us when the joint is at the end of its life, so that we don't have to live in miserable pain. But here at Bodyworks Musculoskeletal Medicine, we specialize in non-surgical options, and our goal is really to extend the life of the joint and even regenerate the joint if possible. So, how do we do that? How do we get things to perpetuate such that we have longer life to our joint? Well, it really harks back into what is the problem with osteoarthritis. Well, the problem with osteoarthritis is wear and tear. So the things that we want to look at to help with that, at least from a preventative standpoint, seek to limit the amount of wear and tear that we have in our body. And then further, we can go into regenerative medicine and how that is kind of coming down the pipe and really showing things that we can use our body's own healing system to build the joint and perpetuate it itself. So the first thing we're going to talk about is viscosupplementation. So what is viscosupplementation? Well, first off, the fluid inside your joint that we talked about earlier is called synovial fluid. This is primarily made up of a substance called hyaluronic acid. What this does is it provides a lubrication in between the joints, it cushions the joints, it essentially acts like a shock absorber. So when you're a young man jumping up and down, putting a lot of pressure on his joint, if you had two bones sitting right on top of each other, this would put a lot of pressure and really beat up those two sides of the joint. But having the synovial fluid in between, it's kind of like pushing on squeezing a balloon. It really takes some of that pressure off and disperses it. Now, when we are young, or I should say in a healthy joint, the synovial fluid full of hyaluronic acid is thick, very much like a heavy oil, whereas once we get injuries and once we get arthritis or basically anything that's inflammatory going inside the joint, it starts to thin out the synovial fluid, starts to break it down, and it becomes more watery. So viscosupplementation is basically replacing the hyaluronic acid that's normally inside the joint with a new version. A lot of people, when I get to this point of explaining the process to them, they go, "Oh, it's kind of like an oil change." Well, to be honest, it's not. That's not too far off. We start out with this hyaluronic acid, with this joint fluid that's very thick. Over time, it becomes watery. Well, what do? We go and we take more oil, put it in there, the hyaluronic acid, inject into the joint, and the fluid inside the joint becomes thick again. So the viscosupplementation, the word is actually the process of putting more hyaluronic acid inside the joint, and it does three things. Basically what the synovial fluid in your joint is supposed to do anyways. Cushions the joint, lubricates the joint, but it also encourages your joint to produce again. And I think this is a real interesting thing. So again, here you have your joint space with kind of a weakened hyaluronic acid inside it. We take an injection, we put big thick hyaluronic acid in, ends up with a lot of this thicker hyaluronic acid inside the joint. And then what does that do? was interesting. So once we have injected the hyaluronic acid from the outside inside the joint, it stays in there for a little bit, eventually gets broken down, and it leaves the joint. Well, once it leaves the joint, the body gets this sensation. Just the way it normally works is it goes, okay, a whole bunch of this stuff that is normally inside the joint is getting outside the joint, so we need to produce more, we need to replace it. And so the body comes along and makes more of its own. And so now you've got the body perpetuating this nice, thick synovial fluid full of hyaluronic acid inside the joint with what we put in there has been taken out and the body's perpetuating its own. So for that reason, we like to have that stimulus to the body to create more. And this is the reason why we do it multiple times. So you may have heard, if you've heard about this before, it's a 3-time shot or a 5-time shot done once a week for 3 weeks, 4 weeks, 5 weeks, something like that. This is the reason for that. This is the reason why multiple shots tend to do better. One, you get more of it inside the joint, but also you get these multiple times that the body gets this stimulation to produce more of its own, and you get this more long-lasting result. Hyaluronic acid is a natural substance. It's not even considered, again, it's what's normally makes up most of your joint fluid anyways, but it's not even considered a drug. It does not chemically change the makeup of your body the same as a drug would. It's actually considered a medical device. So it's as if we're putting a liquid buffer or something inside the joint to help prevent further wear and tear. That is what it is designed to do. It will not interact with current prescriptions. The injection is not something you can get at your local health food store. However, it's funny, when the slide was first made, that was kind of true, but now you're seeing a lot of hyaluronic acid in your local health food store, both as a supplement that you can take by mouth, mostly to try to help with hair and skin, but you also see starting to see commercials for face creams and things where they're actually talking about the hyaluronic acid that is inside these face creams, again to help with skin and that type of thing. So again, a very natural substance that is normally found in the body. So the dangers involved with it are limited. It doesn't have near the side effects, for instance, as the steroids, which are much more commonly used. It is FDA cleared and administered by medical specialists. So what's the catch? Well, you know, I mean, the biggest catch is you have to get this done multiple times. You know, it's a series of 3 to 5 injections, but other than that, there's not a whole lot. It is very safe. It doesn't have the side effects that other drugs would have, and in my opinion is a highly underutilized treatment that insurance pays for. This one is in the pipeline. This is the way, you know, this is something that can be used in any medical practice, but I think it's highly underutilized, usually only getting pulled out right before surgery, and at that point it's way too late in the game. Needs to be used much earlier on to prevent. Again, it's usually used to try to get pain relief, but really the purpose of this is really to prevent and limit the amount of wear and tear that's happening on the joint and catch things much earlier than it's currently being used. So perhaps you've had these injections before. Well, first we want to make sure that it was actually, you know, a proper hyaluronic acid injection. It wasn't just steroids. Synvisc, Monovisc, these are some of the other companies that make this stuff. How was it injected? Was it a series of 1, 3, 5? So initially 3 injections, back in about 96 is when Synvisc released and started doing this stuff. Then in the early 2000s, they went down to about 1 injection. This was really out of convenience more than it was efficacy. It wasn't that 1 shot was any better than the series of 3, but it was easier for doctors and easier for patients just to do 1 shot and go, well, see, did that help? So unfortunately, the one-time shot is something you see a lot in the orthopedic offices. Most of my people that are coming from surgeries who have had this before had the one-time shot. The most recent have been a couple of companies, Hyalgan and Suparts out of Germany and Japan respectively, who said, no, you're actually going the wrong way. We don't want to have less injections, we need to have more. Again, get more of the substance inside the joint over the period of time, but also get this continued stimulus for the body to produce more of its own fluid. And we see better results that way. Also, when it's combined with some other therapies that allow the fluid to really get pushed around in the joint and move to the right areas, and doing some therapies that take some of the pressures off of the main area of wear and tear, you get even better results. Did you see the injection happening? So this is a lot of times the injections are done blind, meaning there's no imaging done. This is not always important, but with hyaluronic acid is extremely important. Something like a steroid or other medication, you're trying to get this absorbed in the tissue of the joint. So that is something that you can actually just get near the joint and will see good results with. However, this stuff, because it is not a drug and it is a medical device, has to be inside the joint, has to be inside the joint capsule. If it is injected outside the joint capsule, apparently might make your skin look nicer on the front of your knee, but if it's not inside the joint capsule, will do absolutely zero for the joint itself. It will not benefit the joint at all if it is not definitely inside the joint. So it is very important to use some type of imaging, ultrasound, or even better, X-ray, where you're putting some dye inside the joint to confirm that the hyaluronic acid is going where you want it to be. Because, even the best docs who have been in practice a long time, statistically, still miss the joint about 1 out of 4 times. I had a patient who came in here, was receiving the one-time shot and was doing pretty well with them. She had received 3 of them over a period of about 2 years, and then went in to get her latest one. They did the shot, did nothing, 0 for her, and they went, well, okay, it's not working anymore, it's time to go to surgery. Ironically, so that out of 4 shots, 3 of them did really well, 1 of them did not. I told her, well, hey, let's come in, since you were getting such good results at one point, let's try this again. We did the 5-time shot, but even after the first one, she started having, was having great results. And it's unfortunate that, ironically, she had exactly the same amount. It was kind of that 1 out of 4 shots you probably missed. And that's why she didn't see any benefit from it. So it is crucial, particularly for those one-time shots, were about a $1,200 shot, that it's going inside the joint. Should look something like this, with a X-ray guidance to confirm that the medicine is inside the joint. All right, so getting back to our better options, number 2 on our preventative medicine list is bracing. So this is a very interesting one. Again, underutilized. A little background, as I pointed out in one of the earlier slides, your knees can wear out unevenly. They don't always go straight down the middle. Now, we use the analogy of the tire. Where the tire is hitting the road, is not the same across the whole thing, and so it can wear unevenly. Here you should be seeing a lot more wear on the inside of this tire than the outside, which, you know, ultimately, if it wears down too much and continues to have pressure on that side, that's something we can see. The joint can react the same way. Now here in this x-ray, you're seeing much less joint space here on the inside. This is the inside of the gentleman's knee, or lady's knee. This is the outside. You're seeing much less joint space in here, a lot more wear and tear happening on the medial part of the joint. So as this person continues to put pressure on the joint, this is where a lot of that pressure is falling, and this is the part of the joint that's going to wear out, eventually blow out, as it were. So if we can't really rotate the knees the same way you can rotate your tires, but we can mechanically try to take the pressure off this side of the joint. One way of doing that, a very good way of doing that, is something like this, which is a unloader brace. In this particular instance, used as a medial unloader brace, where this on the outside pushes inward, and what it does is it applies a pressure from the outside, which pushes the joint this way, shifts the center of gravity over here, and actually opens up the inside of the joint. These two pictures were taken of the same knee on the same day. This is an individual joint. You can see here how, again, this is another medial one, where the person is putting a lot more pressure on the inside of their joint than they are the outside. Took the x-ray, we can see that. Put the brace on, all of a sudden, instantly there is an increase in the joint space, and we're taking some of the pressure off, decreasing the amount of wear and tear that's happening right at that specific spot. Specialized physical therapy is the last part of the preventative medicine trio. Now, we talked about physical therapy before as being something that is currently used for knee pain osteoarthritis, but again, this is generally, it becomes a general physical therapy. You're going to a good therapist if they're bringing you in, working with you, trying to address some of your specific structural problems, and not just giving you a list of exercises to do, or putting you on a treadmill and trying to work on you. They need to be looking at the joint itself, looking at the angles of not just the joint, but also how it reacts with your hips, with your ankles, really how it is your whole system is working together and putting the correct pressures on your knee that it should be putting. For instance, they need to be addressing, this is actually looking at the hip, the angulation of the hip, and seeing how much motion is in one hip versus the other. As you can see, this hip has a lot more external rotation than this hip, and those are things that need to be addressed. And physical therapy has ways to do that, but here we can see how this individual, because their hips allow different types of motion, then they are putting different pressures on their knees than they should be, and so addressing these things help address what pressure is being put on the knee and where, and this really gets to the heart of what the problem is with the wear and tear, and help eliminating some of that. So a specialized physical therapy that is really keen in looking at the joint, not just in strengthening the muscles around the joint, but looking at the mechanics of the body is crucial. So here is again, the current medical algorithm, which in my opinion is poor. Even in the best situations, it typically is maybe some general physical therapy in the beginning, definitely steroids that have come in the beginning and tend to come a long time down the line as people just, docs and people, just look at covering up the pain, making it go away for as long as they can, and they keep doing steroid injections until the joint is brittle and nearly obliterated, and then at that point, typically the gel, the viscosupplement becomes a thought. We try that typically, again, a lot of times I hear the one-time shot. If it helps, great. If it doesn't, off to surgery. It is a poor model for how we should be treating our joints. Better model is the prevention algorithm, what I'm calling the prevention algorithm. As soon as somebody, a young, healthy person, starts to have an instant of joint pain, start to feel something on the inside of the joint, on the outside of the joint, this is the body trying to tell you that something is wrong mechanically. And physical therapy should be one of the first things that are done for them to address some of the biomechanical problems that are going on, such that they can be fixed while the joint is still in a healthy condition, and it can optimally be used to maintain the life of the joint as somebody continues their physical activity. If as it progresses, which again wear and tear ultimately will, and we start to see some of the signs through imaging, through physical exam, we start to see some of the signs of the early wear and tear setting in my opinion, grade 1, but definitely into a grade 2, then viscosupplementation should be one of the next thoughts. Really, we want to get in there. If somebody's having some consistent pain, we want to get in there, provide a lubrication to the joint, get it set up to provide the most amount of buffer protection that we can, again, while the joint is in a good, healthy condition, to extend the life of that joint. As that continues, bracing, if we see particularly if we're seeing things on changing that would indicate, changes on imaging that would indicate that one side of the joint is taking more pressure than the other, then bracing can be used to try to negate some of that. If all of those things don't work, or once they all fail, which again, ultimately everything will, and the individual is still having pain such that it makes functioning difficult, well then steroid injections should be a consideration just to get somebody by. Maybe they're not quite at the point where they're ready to get their joint cut on at that point, but they do need something to help them with the pain. Then the steroid injections at that point may be worth it. Again, when we're kind of looking at the end of the life of the joint as being imminent, and then ultimately going on to surgery. Now, this is the algorithm that would be utilizing what is currently available by insurance. Insurance will pay for these for everything on here. And should be utilized in this type of algorithm, in my opinion.